So it's my distinct pleasure to introduce Brett Elam today. He has been the Capital Program Operations Manager for the last 2 years at the University of Maryland Medical Center. We actually asked Brett to come and do this. This is a little bit of an encore presentation for him. He presented this at Elevate, our annual user conference, and it was one of the most popular sessions that we've had to date. So we've asked him back to go ahead and take this to a wider audience. The topic today, as Julia mentioned, is how to leverage eBuilder to collaborate with the extended project team, and that is how to get your contractors and architects involved with you as an owner in a collaborative fashion. So with that, I'd like to hand it over to our speaker today. Brett, the floor is all yours.
Thank you, Dan, and thank you, Julia. Thanks for eBuilder for allowing us to come share this. It was a privilege to share it at the user conference as well. So good afternoon, everyone. As Dan said, my name is Brett Elam, and I'm with the University of Maryland Medical Center. Work with the project management team here. And but prior to eBuilder, we recognized our need to collaborate better with our contractors, architects, external consultants. We've been using eBuilder for about 5 years, and we began probably similar to where a lot of people began, which is before eBuilder. We had an internal folder structure that wasn't accessible to outside contractors, so when drawings were sent in, RFIs and submittals, it was this constant emailing back and forth, Dropbox, things like that. Documents were shared via emails and FTP sites. We had documents in different places, so there were things that we needed to have access to that were in the contractor systems, and vice versa. So again, we were working with what we had, but we recognized that one of the challenges we were having was having all of the right project information in one location, accessible to all parties, because things like RFIs, submittals, critical documents really need to be accessible live by all parties involved in order to ensure the project moves along successfully, on time, on budget, and there are no gaps in scope or anything else. So this was where we were before eBuilder. We began eBuilder, and it started out as primarily a file sharing structure for us. We wanted to make sure we had documents in a centralized place that could be accessed by our contractors, designers, and consultants. So when we began, we actually did have external parties on our account from day one. It started with a smaller group. We didn't start with everybody, and that's one of the things that I would recommend and have recommended is be targeted in terms of the projects that you get started with and the things you start with right out of the gate. It really helped us sort of having a plan and biting off a size that we felt was doable and allowed us to learn. We very quickly realized the benefit of using this system and expanded very quickly and pretty broadly. Also started using some forms and workflows right out of the gate, which we'll talk about as well, which then led to being able to get reports and good data out of the system, which helped us just learn how to leverage it even more. So as I said, we've been using it for about 5 years. We've had outside folks since the beginning. Started with a few and increased. We started with a certain number of licenses, and then about 2 years in, we realized, hey, we're really wanting to get all of our folks on board, because it became anything that wasn't done in eBuilder just became more of a struggle. Initially it was people were learning the system. I don't want to say struggling with it, but whenever you learn something new, there's a learning curve there. So it became, but very quickly within 2 years, it became, hey, if we're not doing that via eBuilder, that feels wrong. It doesn't feel right. It's not efficient. We just got to get everyone in there. So our current breakdown, 227 total users, and you can see that we actually have more outside users than inside. We also have several internal customers, which we'll talk about as well. This was actually, as Dan said, this was a slide, a presentation that we gave at Elevate, and since then we've added, I think, 60 users. We had a couple of really large projects, new hospital project, really large renovation projects get going. So we've since added probably about 50 external folks and another 8 or 10 internal folks that we've hired to staff up those efforts. So documents and standards, as I said, we started with eBuilder being a centralized place for all documents. We want to make sure all files were in the same place and that we could have access to them. Permissions is something we thought a lot about because we put all of the project documents into eBuilder. Even the documents that the contractors and the architects don't necessarily need to see. So our internal budgets, our internal approvals, certificate of need documentation, things like that. We put all of that in there because we don't want to have to go find that in multiple places. If there's a project record, then all documents related to the project should be there. Permissions within the system allow us to set who can see which folders, which is really nice. So we just have to make sure our internal teams know that this is a folder that these external folks can see. So you shouldn't put something in there that you don't necessarily want them to see. So we had to do some internal training and document exactly how we wanted files to be set up. So this is something we had to spend some time on in the beginning, but it was worth the effort because at the end of the day, we feel we have a good folder structure and a good practice for how we're filing documents into the system, how we're sharing things that we need to share with the architects and the contractors, but ensuring that they don't see some of the things that they should not see. So within the system, you set up a template project, which you then use to create future projects. So your template is your template, it's your folder structure. And the way we chose to do it, what made sense to us was to do things sort of chronologically. So we have our project support documents, all of our setup stuff, our initial budget, our approval, our account code setup. Then we move in through the contracting process, bid and awarding the A&E team, the contract, then into schedules, cost estimate planning, and then further on down it goes into construction, FF&E, and closeout. So this is what made sense to us. What really nice thing about the system is that you can build what makes sense to you, and you can give the ability to add subfolders or not add subfolders if you really want things to be placed in the appropriate folder. So you can not allow things to be uploaded into a root folder. So if you see here, there's actually subfolders under schematic documents, and those are for the drawings, the specs, the narrative. And we don't want people just throwing the documents in that root folder, so we disallow those permissions. So they have to actually select the right subfolder to place things in. So this, again, it took some time up front to think through how to build this and which permissions to give. So obviously during the planning and design phase, the architect engineer have access to most of those folders, including the ability to upload, because we want them to place, when we want a DD set from them, we want them to place it in the folder, not send it from their system or send an email with a really large attachment. Just place it in the right folder so we can all get to the right information. The internal training and education, so this is just a snapshot of a document we have where we went through and identified, here's our folder structure, and here's where you should place things. Here's where you should add subfolders. Here's where you shouldn't, putting nothing in the root folder. And then we tried to highlight that, hey, these are folders that outside folks have access to. So the ones in yellow mean that somebody besides a medical center or medical system employee can see that folder. And it makes sense because, change order requests and change orders, the contractor is submitting those through the system, so obviously they are going to have the ability to see that folder. And subsequently, the architect is going to have the ability as well because they need to see those documents in order to review them. So this has been very helpful for us. It's definitely a recommendation when thinking about setting up a folder structure to do that. Sorry. So again, it's really helped us in terms of initial training, but also just ongoing learning. When someone new comes on board or we get a new contractor, new architect, be able to provide them a document that shows them exactly what to do and walks them through it. So here's an example of permissions. So the One of the things we really like, many things we really like about the system is the ability to get granular with permissions. So you can decide if someone needs to view something in a folder, download something from a folder, modify, create folder, delete. Obviously certain permissions you don't want to give most people, but it's nice to be able to say that, hey, in this folder, I know clinical engineering can view and download, but they really don't need to upload files or get to anything. They just need the ability to actually view the documents. So this is something to spend some time on initially. It does take some thinking to get through, but it really pays for itself in terms of the product you get afterwards and a good folder structure. So the other thing that we sort of grew into, so that was sort of setting our standard documents. So all projects get created, have that standard folder structure. Everyone knows where to place documents. Our architect, engineers, and contractors know how to access documents. Prior to that, up front, we actually maintain a project where we house all of our front-end specs, our design services standards, our architectural MEP standards, so that when we're bidding out work or getting folks on board initially, they can actually go to this site. So many times prior to this, we were sending out a design RFP, and it's, well, who's got the latest copy of the MEP standards, and who's got the latest logos, things like that. But we actually have one place in eBuilder where we keep those documents, and they're publicly accessible folders. And what that allows is we can actually send a link to these folders and say, here are our design services standards, so that when our internal team goes to update those standards, all they have to do is put them in the same place, and then communicate to us that, hey, we've made these changes, here's, and we posted them to the site. So that's been very, very helpful for us in terms of sharing, because then design teams, contracting teams can actually go through and access these from the system, and we don't have to remember, what's the latest version, where is it located. It's always in the same place, and if we're using that link, then they're always going to get to the right document. So you can see those folders there that with the arrow means they're publicly accessible. So we keep all of our standards in this public project, as we call it, which has been very helpful for us. And that's actually one thing that we've gotten good feedback from our architects, contractors, and everyone else on, is that that's been helpful, because so many times they would have to ask their project manager or other folks, where's the current copy of this standard, and that's been, alleviated a lot of those concerns. We've also, in the same project, we've also done the same for our life safety plans and our architectural plans, as well as training materials for how to use eBuilder. And some of these are general training materials for how to use eBuilder sites, some of them that we've developed internally for things that we use the system for specifically, which are things that we'll go into shortly. But we place all of these out there as well, and they can access them in a similar fashion. So you can see here where we've got the base plans, the CAD plans, and then these are a couple examples of training guides for submittals, which is a pretty standard module in eBuilder, and then a construction site survey form, which is a form that we developed for our own use based on renovation work in a hospital, which is most of our work. So this form is very tailored to interior renovations within hospital environments. So, and that kind of segues into project forms. So we've established a folder structure, a template. Everyone's using that. All projects get loaded with that. The architects and consultants can use it. They can also access our standards, our base plans, all of the things that they need to do their work well and perform the way they need to perform. We also have created and used several forms internally for documenting pieces of work. One of them is site conditions for use during inspections. So this is a form where the contractor, and this is how we collaborate. Prior to this, we required our contractor to fill out a paper form for every day they were working on site, just documenting that the infection control provisions were in the right place, the life safety provisions were in the right place, what was going on the job site, crew counts, things like that. For exterior projects, we would do weather conditions. And we did one as well, and we actually transitioned that into an electronic form. So every day our project managers with their smartphones, their tablets, or just go to the job site, come back to their desk and document, fill out a site survey form, and the contractor does as well. I was actually walking with a contractor earlier today who's just getting started, and wanted me to walk through the first time with him, and he was, doing it on his iPad. So I think that's sort of where we've moved to and sort of gotten away from a lot of the, fill out a bunch of forms, scan, email, file. There's 3 or 4 steps there that take up a lot of time over the course of a job. We've also done forms for performance evaluations, conditions during other QC inspections, and then transmittal information as well. So here's just an example of the forms that we have, different types of forms, what projects they apply to. These have been very successful for us because it's once you fill out the information and complete it, you hit post form and that's it. It becomes part of the project record. You don't have to worry about scanning it, emailing it, filing it in the right place, and then all the information is reportable. So our director or whoever can see a report of all the surveys completed this week and how's everybody doing, what are the compliance issues, things like that. So this is a little bit highlight of our construction site survey form. So as I said, it documents infection control, life safety, general site care. We pretty much do it completely on either smartphones or tablets in the field. And we like the forms because they're very flexible. You can build forms to do whatever you want and document whatever fields you want. So like I said, this was tailored very much to us. The infection control tab and the life safety tab are things that we developed internally as good practice for healthcare. Part of those are based on industry standards through Joint Commission and NFPA, but part of them are just things that we as a university hospital think about. You can also copy folks, so whenever I fill out a form, the construction manager can get a copy. Whenever they fill out a form, I can get a copy. Just to see it in my email so I don't have to go back in and look at it. But forms have been very, very helpful for us. This is just one example of one that we probably fill out, 40 or 50 of these a week, and we've been doing that for years. So it's really saved us a lot of time, a lot of paper, a lot of scanning, filing, and email steps. So this is just an example of that report where you can go through and see. So Whiting Turner is a general contractor that was working on a project with me, and the forms that I filled out, the forms that the superintendent filled out, and again, we can see all that information. Another one that we've used more recently as we've done renovation work in some of our inpatient behavioral health units, because working in those areas is a little bit different. Most times in healthcare, you're worried about infection control and life safety or your 2 primaries, and we're not worried about those here, but we're also worried about leaving tools behind, having a buddy system, making sure the room turnover is done correctly. You don't want to leave a screw or something not attached properly, because that can cause a really big issue with a patient. So we were in and out of a lot of behavioral health rooms last fall doing a lot of urgent work. So we created a form that whenever we turned over a room, we would close a room for multiple days potentially, and these are very critical spaces, so we would actually document that, hey, this was me filling out the form on a tablet in the field with the contractor and a nurse or someone representative from the unit saying, hey, this is the work that was done. We removed all of our tools. We cleaned the room. Your staff approved, and document the name of the person who was with us and approved it. This was very valuable for me and our internal compliance team to be able to show that, yes, we are doing our due diligence. The work was done safely. The results were good. And we actually did have an issue where someone, a few weeks after we had done the work, a patient got a hold of something that was inappropriate. And I was able to go back to that form and say, look, we don't think, we didn't leave this in their room. Here's who I looked at it with. Here's the nurse who signed off on it. So it really kind of helped us cover that. Now, we still had to figure out where it came from, and we did, but we were able to show through documentation that it wasn't something that was caused by construction. It was due to another unrelated issue. So those are some examples of forms we use, and forms within the system, sort of what I equate them to is just documenting some information and putting it in a file cabinet. So it's really, a site survey form, a checklist, an action item, which is maybe you send something, to one person and they do it and then that's it, but it's not sending items through multiple parties and multiple approvals and multiple steps. But there is a way to do that within the system, and those are called project workflows, which we use quite heavily as well. So we're currently using workflows to manage requests for information during the construction process. Pretty traditional routing in terms of the contractor asks a question, goes to the architect. If they have a question for the owner, they can send it to us. They'll provide the answer. The contractor has to decide, has to say the answer, gives them what they need to proceed, and then we move on. We're also using it for requesting outages, for requesting security badge access to spaces. That one's been very helpful in a way we can collaborate with both our contractors as well as our security department within the hospital. So these are just some examples of workflows we're using, change orders, pay apps, all of that. So all of this is a way to collaborate with external consultants. And a couple of really nice features about workflow is that, you define who it goes to, you define what they see. So, information that goes to the architect and then it comes to me, there's probably more information I'm going to see that maybe they did not see. And you can really define that granularly on the step level, on the field level, things like that. So we like that a lot because it allows us to develop a tool that actually fits our business, right? We have a particular way we do business, as do most universities and hospitals. We all have our ways we like to do things. And this is a tool that's flexible enough that we can actually make it, we can actually build what we need to build in it and make it work for us. So I want to highlight outage request process. When we started with the system 5 years ago, I think we started with either 2 or 3 processes, workflows, and this was one of them. If anybody out there works for a healthcare entity or hospital, so a utility outage is any time you're going to affect an existing system in a hospital, right? You have to shut off a domestic water riser in order to do some tie-ins on the floor. In a healthcare facility, those things are critical because you have to understand what you're turning off, how it's going to affect the other floors, and ensure that you're still going to maintain the environment you need to maintain for patients. So prior to eBuilder, we had a paper form where the contractors would complete the information. They would tell us what system they're turning off, the research they had done, what work they're trying to do, who the points of contact were, dates and times. That piece of paper would be handed to the project manager or somebody else during a meeting, and then the project manager would sign it, approve it, and then take it to our operations and maintenance folks during an outage meeting that we have every week. They would sign it, approve it, update the dates, and then hand it to someone who would then input in this big log master spreadsheet, right? So lots of paper, lots of data entry steps, things like that. So we thought, well, this is really, a great opportunity to leverage technology and get away from that. So we actually use this as a way to engage not only our general contractors, but also our subcontractors. So we actually have subcontractors who will submit outages in the system. If it's submitted by a subcontractor, the CM will look at it first, CM or GC. If not, it'll come to the project manager. The project manager will review, approve, ask questions, and then send it to the outage meeting. Now, we still have the outage meeting, but it goes very different. It's in a conference room with a projector and a screen, and our outage manager pulls up a report from eBuilder and opens up each outage, talks about whatever they need to talk about, because there's still a lot to discuss, and especially in existing healthcare facilities, things aren't always tied in or routed the way you would think, so you can't just send something through and necessarily have it get approved. So there's still discussion, but he updates the notes electronically and then approves it electronically. The contractor gets a copy in their email, and then we're done. They're off and going. And then we can run reports every week that we send to our operations and maintenance team and our security team saying, here are the critical outages occurring this week. So this has been a real big success for us. Saved us a lot of administrative time, 4 or 5 hours a week. And once the contractors got used to submitting them, they really actually like this because they don't have to, fill out 4 or 5 pieces of paper, remember where those pieces of paper are, remember them to take those pieces of paper to the project manager, try to find the project manager. It's all done electronically. So after the initial hurdle of sort of training and getting folks used to it, we've actually received very good feedback from the contractors that they really like the way this works. So it's a very simple workflow. Kind of goes through PM, outage meeting step, outage manager, and this is an example of what a workflow looks like in the system. And these can be, all these steps are editable, they're changeable for whatever the business process is you're trying to do. So this has been very successful for us. Similar, we process our hot work permits and RFIs, but this is one that I would say has saved us just hours and hours of time every week, and notebooks full of pieces of paper that we use to try to maintain. So this is an example of the report that gets pulled up. So our outage manager will filter it or sort it by the contractor. They'll pull it up and say, hey, Brown and Heim working for Brett, what are you trying to do here? We're demoing circuits. Okay, pull up the drawing, and then we can approve it. So it's been very helpful, very efficient for us, saved a lot of time, and also provided a lot of really good documentation for our operations and maintenance team. And documentation when it comes to hospital utility systems is very critical. So that's how we've, the ways we're using the systems. There's a lot of other ways we're using it as well, but those are, documents, forms, and workflows. I want to talk a little bit about our training program, because any time you make a change, whether it's going from sort of your folder structure, paper process, which is where we were, to a system, or from one system to another, if you already have something, there's always going to be an element of training and a learning curve. So like I said before, we started with a select group of projects, and we identified projects that were either early in their planning or design. Really, that's not either, that we're early in their planning and design, because if something was already 75% complete in construction, we didn't feel it was worth the effort to try to go back and backload. Now, once the job was done, we sort of took some key documents and did a document transfer into an archive project. But for the most part, we were identifying things that were early, and we said, okay, here are 5 or 6 projects of varying sizes that are early, that we can work with the contractor, work with the architect, get used to the system over a course of 3 or 6 months, and then after that period, basically say, okay, anything new starts in eBuilder. We hit that threshold pretty quickly, I will say. Probably about 6 months after we began, we sort of hit the, okay, everything new is just going to be in the system, especially with outages and things, because we just immediately recognize the value. So during and after the go-live, aside from the training we did for our internal team, which was a couple of days on-site with eBuilder, we actually held monthly training sessions for contractors and designers. So one of our staff members would be in a conference room for 3 or 4 hours in the morning, and just bring in those new folks and walk them through the system. This was very helpful. We probably did that for the first, not quite a year, maybe a little less. And now we've gotten to the point where our project managers know it well enough that when new folks come on board, contractors and designers, they can walk them through, here's how you do submittals, here's how you do RFIs, here's where the documents are, here's, our expectations in terms of how you access the system. Since then, we've also been developing our standard training guides, which really just give screenshots and sort of step-by-step instructions on how to use our RFI process, how to use our outage process, how to use the submittals module. So that's been very helpful for us. The reaction, one of the questions we get is, what is the reaction when you start a system like this and you go to your architects and your contractors and you say, hey, this is, you have your systems, we have ours, and this is how we're going to do it. You get a little pushback initially. I will say the smaller firms sort of appreciate it because a lot of them don't have systems that allow them to do some of these things. The bigger firms that already have Newforma, Prolog, P6, things like that, you get a little pushback. But over time, we work with them, we transition them, and honestly, after a period of time, we just, we're the owner and they work for us. So we need to see things a certain way in order to be able to manage our business. And part of managing our business is them providing us what we need. So it's in our contract language to use eBuilder, so there's no surprises. Everyone knows it, whether they like aspects of it or not. But it's all in there, and there's no surprises in terms of our expectations. So we have a training project that whenever we do hold training sessions, and now that we're 5 years in, our training sessions are more ad hoc, where someone will sit down with a contractor or two who's getting started. We recently just started a brand new hospital project with a lot of people, so we held a few sessions where we put them in the training project. ran through RFIs, ran through submittals, things like that. So we do maintain a training project on the account that not only does it have the full folder structure and it has everything in it so you can go in and process RFIs and outages and things like that, but we maintain our training guides here, and we leave access to them. So they can always have access to this. They can always come back. Sort of a training project / sandbox. We have another project for testing things. And this has been very helpful for us. And it's something when a new person comes on board, especially internally, you sit down with them, you run through things. And then new contractors and architects, like I said, now that we're this many years in, it's more ad hoc. And then the PMs are doing it, for the 1Z, 2Z folks that start on their jobs.
Great, thanks, Brett. That was outstanding. So I do have a couple questions that have come in already. Just as a reminder, you should see in your GoToWebinar panel there's a questions section. Just go ahead and enter any questions that you have, and I'll start going through them with Brett. So before we get into the questions, though, I did want to let everyone know that we do have an upcoming webinar demo series coming in the next several weeks. And you'll see on your screen that these are broken down by vertical. So depending if you're government, education, K through 12, or higher ed, commercial, or healthcare, there's a demo specifically geared towards your specific vertical. So I know Brett was using some screenshots of the product to show you how they accomplished some of their goals. This will be us going live into the product, but we are focusing on very specific pain points. So I'd encourage you to go to the website that you see on your screen. Also, Julia has pasted that URL into the chat window. So if you want to click that and register for one of those webinars, they're only 30 minutes from beginning to end. So it'll just be a quick investment of your time. So with that, we'll go ahead and move on to our questions. And again, I encourage you to enter any questions you have in the question panel. So the good news, Brett, you already answered one of the questions around the reception from architects and contractors into using eBuilder for you all, so thank you for that. Another question that we got was that you showed workflows and one of your forms that you've customized. Did you have to go back to eBuilder for those customizations, or can you do them on your own?
No, you can do those on your own, and for the most part, I think when we started, eBuilder helped us develop our first, I think it was 2 processes and 2 forms, and since then we've developed everything else internally and made changes to those existing ones. So the system allows you to make those changes and create new forms and processes as needed, which is really nice.
So another question is around the onboarding. So you talked about training both internal staff as well as your contractors and architects on eBuilder. How long does that typically take to bring a new user up and running in the system?
For an internal user, it's probably 3 or 4 hours of going through and showing them everything that we have to know in order to be able to teach someone else. For contractors and architects, I recently did a number of sessions for new folks for a new hospital job, and ended up doing about a 90-minute webinar. And really, in 90 minutes, we pretty much covered everything a contractor or architect would need to know. Now, they'll still maybe have some questions after that, but that's enough time to get through documents, submittals, RFIs, the key components.
Excellent. A couple questions, and these, as I've been scanning through them, Brett, I want you to be comfortable saying that you're not sure of the answer, because some of these seem fairly technical to me, and if Brett doesn't know the answer, then we'll make sure we follow up with everybody who attended the webinar with the answers to these questions. So first one is, can the system accept a CPM schedule software like Microsoft Project or P6 output, so it's showing inside of eBuilder live, so folks can interact with it in eBuilder? Yeah, so that's the question.
Yeah, so I don't know if the question was about importing from those systems or not. Apparently there is a way to import data from some of those systems. I don't want to say that it's all of them. I've heard that. We haven't used it in that way. We do use the eBuilder schedule tool, but we use it for a high-level milestone Gantt chart to track 7 or 8 key milestones, basically for reporting purposes. And then we still get, the full 6-page, CPM schedule from our contractors every week or biweekly.
Excellent. So Mitchell, we'll make sure to follow up. I understand your question. eBuilder does have, as Brett mentioned, a scheduling component built into it for some nice high-level milestone scheduling, but I'll make sure we follow up on specific answer to your question about seeing live output from those other systems inside of eBuilder. The next question from Sylvia is, how did you convince the administration to move from named user to the unlimited licensing model?
Oh, yeah. So actually, eBuilder helped us with that because we, prior to unlimited users, it was a per user fee, and you get a certain price based on different volumes. So every year it was, hey, we're paying this amount of money. Now, you say that, well, the architect's going to pay that. Well, yeah, they're going to pay it, and it may not show up as a reimbursable, but you're going to pay it somehow. So we basically hit a threshold where we talked to eBuilder and said, you know what, we're paying X amount of dollars already for all these users, and for Y amount of dollars, it goes to unlimited based on the volume of our capital program, and the difference was small. So it wasn't a tough argument once we hit a threshold.
Good, thank you. And I can echo that comment on several customers that I have visited. We see customers go one of two paths. Either they say any contractors and designers will buy their own licenses, and we're set up to handle that. But as Brett mentioned, you're going to pay for it. You may not just pay for it on an explicit line item. So good. The next question, and this is a pretty open-ended question, so you can feel free to also kick this one back to us, Brett. But it's really saying, how does eBuilder contrast or compare with SharePoint? And I guess my add-on to that question is, did you look at SharePoint potentially when you decided to use eBuilder?
We looked at several systems. We had used SharePoint sort of briefly years and years ago, but we looked at several systems. The differentiators for us were the workflows, being able to actually create structured workflows that fit our business model, not just, here's how Prolog does submittals or here's how Prolog does RFIs. So that was really the biggest differentiator. The other one we really liked were some of the reports and dashboards, which we use quite often. So I would say we didn't look at SharePoint when we were vetting to buy eBuilder, but we did have some experience with it. But the differentiators were the workflows and some of the reports and dashboards.
Good. So the next question is, do you currently integrate eBuilder with your accounting system?
We do not. We're in the process of doing that. We've been in the process for about 2 years, and that's nothing to do with eBuilder or us, but our hospital system is about to change its accounting system, and it's been about to change its accounting system for 2 years. So we've basically been waiting to transition to Lawson, which we've done some homework. We know eBuilder has already integrated with. So I think the hospital is switching to Lawson a year from now, next February, and then after that, we have it in our budget and our plan to integrate.
Excellent. And I know Julie is going to post a link to a webinar that we have that is available for specifically integrating with Lawson. So you all will receive that here momentarily. So I'm going to do that. So I will go ahead and post that. So if everybody looks in their chat window, you'll see a link to that webinar if you want to learn more specifically about the Lawson integration, which is what we tend to bump into the most in healthcare. Let's see. The next question is, can the system be configured to handle a portfolio of projects, which may be of different types, i.e. commercial, K through 12, government? And I'll take that one. And the answer is yes, absolutely. So not only a portfolio of projects within a vertical, but you can customize workflows, et cetera, based on templates, and those templates could be based on different verticals.
Well, and I can share a little bit there. We obviously don't have different verticals, but we have different campuses. And so the outage process at one campus might be slightly different than the other, and the system does allow us to do that.
Excellent. So along those lines, another question is, can you talk a little bit about size of projects you run through eBuilder? And the real point of the question is there a threshold for project size where you won't put the project into eBuilder, where eBuilder becomes too much overhead for the project?
No, I mean, we sort of argued with ourselves about that initially. We started with some mid-sized projects. Once we realized the benefit of the system, we have projects ranging from $50,000 to, $250 million. And the only thing that changes is, okay, one project has 4 RFIs and the other one has 4,000. But really, we've been asked that question a lot too, like, well, we're worried about $100,000 projects. It's really not that much more time. It's really not that prohibitive to do those. Once everybody is in the system, you just sort of get used to using it. And it really hasn't been a huge issue for us. Now, if someone's doing a $5,000 patching of someone's office, maybe not. But for the most part, everything we have under our capital program is running through there.
Excellent. Hold on one second. I realized I left one thing off the link that I just pasted. So thank you, the person who told me that it wasn't working. I left an S off the end. So I just reposted that link to that webinar. So you will be able to click that link now. So let me see. By having vendors also on eBuilder, did you notice efficiencies? So getting the external team involved in eBuilder?
We did, yeah. We noticed, and efficiencies just in terms of not having to worry about, who was copying who on what emails, because that was our biggest thing, is if somebody, didn't copy somebody on the RFI, or if you're using a workflow in the system, you don't have to remember that. So it eliminates a lot of double work. The other thing it really allowed was accountability, is that, if I have the right report or the right dashboard, I don't have to go back and check the email and say, hey, how long has that RFI been sitting out there unanswered? I can very quickly get that information and then ping the right person and say, hey, why has this RFI not been answered for 12 days? So.
Another question as far as did you use other parts of eBuilder besides the 3 that you showed today, specifically procurement and invoicing?
Yeah, so we use the bidding module for all of our major design and construction RFPs. It works very, very well. That's actually one thing I wanted to mention. When we first went with eBuilder, one of the other selling points for us was we asked them for, clients. Hey, who are some of your local healthcare clients? And we actually went and spent like a little bit of time with the Nova healthcare system in Virginia. And since then, we stay in touch with them. So I had a question the other day from a contractor who said, at Inova, we were doing RFIs this way. And I said, well, let me call them. So it's nice that there's a really large client base and that the client base is very, very willing to share. Invoices, because we don't tie to Lawson directly yet, we are filing invoices in the system, but we're not actually routing them through a structured workflow. We're routing payment applications just to track the approvals from the architect and from us. But because we haven't tied into Lawson yet, we're not actually using an invoice routing process.
Excellent. So another question around costing. So I guess I'll start with, are you using the costing module?
We are. We're just using it manually to track some big things and do projections, which it allows you to do.
Okay, so then you won't have an answer for the next part of the question, which is getting the contractor and AE teams integrated into the cost module. So you're not doing that yet.
They're submitting pay apps through a workflow, but it's really not tied to cost, so we're just not there yet. We tried to get there last year, and then our Lawson integration got bumped. So
got it.
We're waiting.
And we can follow up also on that question in more detail, because I know we have several customers who have integrated the change process into a workflow, and that drives all the updates in the cost module automatically rather than keeping that up to date manually. It's one of the areas where we can demonstrate great value over what you can do in Excel through the automation update of the worksheet. So we'll follow up with that question. Following up on the cost question, what are the price jumps? So Mitchell, we can follow up with you offline. I don't have that at my fingertips. So the question was basically the jumps between the different bundles of named user licensing and when's that crossover point to being more cost efficient to go to an unlimited license. And one thing I can share with you is really when that's going to become a valuable conversation is when you do decide to open eBuilder up besides to just your internal staff. So although the cost will go up a little bit, the value goes up far greater. So we'll follow up on that specific question. Link didn't work. So again, the link I originally posted to that webinar about Lawson was missing an S at the end. So I did repost that link. And what was your primary justification in getting eBuilder approved? And was there an ROI or a value assessment that you did to help justify the cost of the system?
Yeah, we did. Because we weren't sure what all of the savings would be, we knew there would be a lot. The things that we quantified were saving some of the administrative time. So, you know, we quantified actually how many outages do we process a year, and how much administrative time does it take for someone to fill out a piece of paper, sign a piece of paper, walk it over here, scan it, file it, put it in a spreadsheet. So we did that for a few workflows, and that was our primary justification, was reducing those administrative steps in paper.
Excellent. And this is a question for me. So you mentioned you've been using the system for several years, and the usage has increased over time. Is there anything different from the initial ROI you did to justify purchasing eBuilder to today? If you had known this, would have made a difference in when you were originally looking at eBuilder?
That's a good question. The only thing that I would say is maybe, and this is a little bit hard to quantify, but we know anecdotally this has saved us time, is just the amount of rework. Like I said earlier, someone saying, hey, I couldn't email that attachment because it was too large. Hey, I got to go find it again. Or, hey, you forgot to copy Mitch on that submittal. So if we had maybe done a little bit of homework there, we probably could have quantified that a little bit. So that's one thing we've realized, that there's not a, because if you build the workflows right, there's really no opportunity for someone to say, well, I didn't get it, right? And there's no way for someone to say that, because I can go in the system and see, did you get it or did you not? And if you did you look at it? So that's one thing I probably would have, maybe thought about.
And to piggyback on that, another area that I hear quite frequently from customers is the fact that you can look at time spent in every step of the workflow. It gives you the opportunity to go back and review your workflow for potential inefficiencies and see if there's a particular bottleneck. Then you can spend time re-engineering that part of the workflow. So the visibility into every step, who touched it, what did they do, how long are documents sitting between steps, especially as you get into the change order and change order requests in that part of the process. You getting those addressed as quickly as possible will save a lot of time and money, and so those are areas also that the system adds some value. So that is, oh, hold on, sorry, another one just popped in. So are dashboards and reports easily, and I guess that's the key word, easily customizable, because I know they're customizable. So have you done much with the dashboards and reports in eBuilder?
Yeah, we use the dashboards quite heavily. I have a personal dashboard, and for some big projects, I've actually set up project-level dashboards so that the architect, the contractor can see, hey, here's a table with open RFIs by step. There's a table with submittals by step, and you click on it, and it takes you to the root data. So we've used those quite often. They are easily customizable. We haven't done the business intelligence. I know the advanced reporting capabilities that eBuilder has, but they are, I'll say, relatively easily customizable. They're not that difficult to work with. The report engine is like a step wizard, and then once you create the first dashboard and you realize how to configure the table, it's just replicate, and you can do a lot of copying and pasting too.
Excellent. And I did miss a question from the very beginning. At the beginning of your presentation, you went through and talked about folder permissions and setting up permissions and being specific about that and intentional. The question is there a way, do you have a way to see how your permissions are set up across the entire folder structure as opposed to folder by folder?
Yeah, so when you build it the first time, there's an Excel spreadsheet that you create, or that actually I think eBuilder created with us during the rollout to basically import the permissions, and that's something that they gave to us. So we use that tool.
Excellent.
I don't think there's a way to export the current to one sheet, but we use that spreadsheet.
Okay, and I will follow up to see if there is a way, as Brett had mentioned, to get all the permissions out somehow. So that'll be a follow-up on our part. So that is it. Oh, wait, oh, another one snuck in. All right, I'll take this as the last one. So what happens over the course of the project as folders are added and deleted? Yep, so John, good question, and I will make sure that we get a definitive answer for you on the permissioning and such. So that is our last question, and so I would like to thank everyone for attending. That was a fantastic number of questions, which is great, shows a lot of interest in the topic. I'd like to thank Brett for sharing his presentation again with us. As I mentioned, there will be a recording that we'll send out to everyone who attended, and if you are interested in the accounting integration, there's a link in the chat window. So with that, I want to thank everyone and hope you have a great rest of your day.